Okay, good morning to all the audience. I'm Vanessa Wong from IMU University. My research topic for today is nutrition-focused physical examinations in patients with breast cancer. So according to Grobogan's 2020 report, breast cancer is the most prevalent cancer among women in Malaysia. So due to the nature of tumors, patients can experience muscle wasting and fat loss. At the same time, the nutrition-focused physical examination has gained interest in clinical settings because it can evaluate the physical appearance and the body compositions to identify nutrient deficiency without specialized equipment. So it considered as a direct, cost-effective, and quick clinical examination. So my study plays an important role in ascertaining of muscle wasting and fat loss in patients with breast cancer using NFPE. So we conducted a cross-sectional study involving women with stage 1 to 3 breast cancer in Hospital Kuala Lumpur and National Cancer Society Malaysia. So the data collections involve social demographic information through structured interview, anthropometric measurement using digital weighing scale and Seca stadiometer, as well as the NFPE through visualizations and minimum palpation. So the muscle status was examined based on the picture below marked in red color, and then the fat status was examined based on the picture below marked in blue color. So the result further categorized into 3 groups based on the Aspen paper, and statistical analysis was performed using the SPSS version software. And a total of 74 women recruited with median age of 60.7 years and median BMI of 25.1 kg per meter square. So the first figure shows around 62.2% of the patients were mild to moderate malnourished in overall muscle status, and the second figure shows around 39% of the patients were mild to moderate malnourished in overall fat status. So despite the patient having a high BMI, they still can experience muscle and fat loss. So the NFPE focuses on clinical symptoms associated with nutrition with upper body accurately reflects the overall muscle wasting and fat status due to its resistance to edema and accessibility, as well as the lower body reflects the muscle wasting. So NFPE considered as more accessible than other methods like DEXA, MRI, and BIA, and then can facilitate the early developments of personalized and beneficial nutrition care plans. However, the NFPE require the practitioners to have a well-trained hands-on technique. So in conclusions, majority of patients show mild to moderate muscle wasting, and about 40% show mild to moderate fat loss. So my study demonstrated that NFPE can be a feasible, cost-effective, and non-invasive method to evaluate nutritional status in clinical practice. That's all for my presentation. Thank you.
Right, thank you, Vanessa. Again, opening the question from the floor.
I would just like to ask if men can also develop breast cancer, because it's the tissue, right? So I just wanted to know about that, because it's always women.
Yes, men can still develop breast cancer. However, according to the report, it's quite large amount. The person who getting breast cancer is women. So my study tends to recruiting the women with breast cancer. Yes.
Right, thank you. And yes.
Thank you, Vanessa. I'm just wondering, do you complement your data with those, do you add on those body fat analyzers, scale machines in your study? I mean, if you have that set of data, if you can combine with the physical examinations, would it be plotting a bigger picture and at least what they call, give you a numbers instead of just, Do you use that, like those body scale analyzer, body fats?
Thank you for your question. Actually, for my research, I have using the BIA machine to detect the total body fat percentage as well as the skeletal muscle mass. Yeah, so that one, actually, I will present it for next conference as well. Yes.
All right. Any other questions from the floor? It's an interesting topic, nutrition and cancer. I'm just out of curiosity because towards the end you mentioned about personalized nutrition for cancer patients. How would your test be able to help the cancer patients knowing what to eat or what kind of supplements that they could take? Would that be possible? Or in general, do you think that it is doable?
In general, I think the reason why I conduct this research is because nutrition-focused physical examinations can provide me with like direct observations on the patients whether have like muscle loss or fat loss. Therefore, I can give early like nutrition care plans, for example, like to introduce about the protein intake, and then like just recommend a general recommendation. And after I getting more details about the assessment and through the interview with the patients, then we'll give more detailed recommendation as well.
Okay, all right, thank you.